Good afternoon. I'm Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. And thanks for joining me for Facebook Live again this week. This week, you get to go on a field trip. So yeah, I went to NIHMS, Northern Illinois Home Medical Supply, and did a field trip there. And we're gonna find out a lot about DME, or durable medical equipment. And it's the kind of stuff that you hope you don't need, but a lot of us at some point in time in our life will need. And I sure learned some things when I went out there for this field trip, and I trust that you will as well. And just so you know, next week, I'm going to be interviewing our oral surgeon at CGH, Dr. Rob Whitaker. So that's going to be, I think that's going to be really good information and a chance to learn more about Dr. Whitaker and his practice. Before we go to the field trip, I did want to give our usual COVID update. So I would say overall, the trend is still positive. I'm still grateful for where we're at right now in terms of the pandemic. Matt is going to put up our local numbers. There we go. So on the left graph, you'll see the new cases, and red is this week, blue is last week. So I think the one thing that I keyed in on that graph is that we are starting to see a bit of an uptick compared to the week previously and the 2 weeks previous. So, and if you look at that bottom graph, under 20 in particular seems to be the category where we have more cases. And I think this is probably related to, number one, those folks who are unvaccinated. Some of the younger under 20 folks who are under the age of 16, they're not even approved to be vaccinated. And then you just have others who, so far at least, have chosen not to be vaccinated. And I do think that's kind of that group of folks. And you couple that with this new Delta variant, which is now at over 50% of the cases across the country. And it's a little bit catchier than the other variants. And I think that's reflected in those numbers. So, and that's, by the way, that's typical. And you see the positivity rate's 3% out of 3 cases. So I think we must have done about 30 tests that day, and one was positive, so that would be about 1 in 30, 1 in 33. So I think this is different than your typical flu season, in that a typical flu season you're going to see more of with my hand I'm going to try to do this kind of up and down, and then it's gone. And obviously what we're seeing with this new virus is we're kind of seeing up and down and up and down, and now we're starting to see another up. Matt, if you would show our homegrown chart that we kind of use as a visual for what's going on here. Just a second, I'm sure Matt will have that up. There we go. So we've been talking about this, and really to simplify this as best that we can. On the top there is natural immunity. So that's folks who've just gotten the infection. And then you have vaccination, and those are the folks who have a significant amount of immunity because of the vaccines. At the bottom of that, you have the variants, of which the Delta is the latest variant to catch hold. And then you have behavior, and that is what we do in our days and what exposure we have to those variants. So far, at least, the natural immunity and vaccination side of things is still winning, if you will. So that's good. Matt, if you could take that back off, if you would. That being said, it never hurts to get vaccinated. So if you're still thinking about it, we still have a vaccine clinic here at the hospital Monday through Friday, 8:30 to 2:30. We have Moderna and Johnson & Johnson vaccines that are available. So I'd encourage folks, it's not too late. And as these variants go on, more people that are vaccinated, the less likely they have a chance to change and become different variants and make it more difficult to fight them off. Those people that are vaccinated, though, still good news. I mean, some of the people who have been vaccinated can get the Delta variant, can get symptoms from it, but it's really, really rare that those people who've been vaccinated end up in the hospital. Finally, I would just say that the story about this pandemic continues to unfold with all those variables in play. And how that story ends up unfolding, I don't know. And I think folks who seem to have it for sure figured out probably don't. So we're just going to try to do our best here at the hospital to continue to keep our patients safe, to keep our employees safe. And I would ask for those of you out there in the community to do all you can to follow guidelines to keep yourself safe as well. And we'll get through it. So with no further ado, thank you for listening. And we're going to go to our field trip at NIHMS. See you next week. Hello and welcome to our Facebook Live field trip this week. I have with me today Melissa Sheppard-Miller. Hi, Melissa.
Hello.
And Melissa is the Executive Director for the sign above us, Northern Illinois Home Medical Supply. And so today, Melissa, we're going to get a chance to take a look and see what's going on in here.
Great.
Hey, before we go in, because when we go in, we're going to wear our masks. But before we do that, I wanted to ask you just a few questions.
Sure.
So the first question is that I had on my list, that just to make sure that folks understand, can you explain how NIHMS is structured in terms of its ownership?
Yes, Northern Illinois Home Medical Supply was established back in about 2001 as a joint venture with KSB and CGH Medical Center. Both of them had their own respective DME companies, which is a durable medical equipment company, and they decided to join and become like Northern Illinois Home Medical. So back in 2001, they established to have a joint venture.
Okay, and so what exactly is the mission? I'm going to start using another acronym, NIHMS. That's what people around here
Correct.
call it, NIHMS. So what's the mission of NIHMS?
NIHMS, of course, is the initials of Northern Illinois Home Medical Supply. A lot easier to say NIHMS than it is the whole thing.
Sure.
So the mission is compassionate care and quality product. It's not just words, it's the way we try to do business.
And Melissa, we're standing right here in kind of that intersection where you have, on one part, you have like the Sherman-Williams place, across the street is Kohl's, just to give people some sense of where we're at here in town. I don't know, it's a corner of...
Route 2 and East Lincoln Way.
Oh, we can even take a picture of it. There we go.
We do a lot of advertising for Kohl's and now Kunis.
Yeah, exactly. And I know you have another facility in Dixon, right?
Yes, we also have a facility at 1309 North Galena Avenue, and there we do a lot of business for Culver's, saying we're across the parking lot from Culver's and right down the road from the Dixon Clinic.
Yeah, there we go. Okay. So one other thing before we go in and start looking at the equipment and kind of
Sure.
Doing a field trip, a show and tell. So tell us a little bit about like how this works in terms of, do you need a prescription for a lot of your DME, durable medical equipment, in here?
Okay, what most viewers and participants need to understand is that we kind of are a do-all at Northern Illinois Home Medical. We do have retail items, so you can come in and actually shop for items. Although if you want something billed to your insurance, if it is eligible to be reimbursed, then we do need a physician's prescription, and there are certain requirements with that being said, such as seeing a doctor. Medicare changed their standards a few years back that a patient has to be seen. They can't just call into the doctor and say, hey, I need a wheelchair, or hey, I need a walker.
Okay.
We do have to have some substantiating dictation to warrant that.
Okay. The one thing I'm sure your staff is pretty good at, though, is you work with folks about what they need and what they need to get and all those type of things.
Correct. That's where somewhat of the compassionate care comes in. We have a lot of facilities, whether it's an independent living facility, whether it's a nursing home facility, patients just going in and out for rehab, and or just patients at home. We try to allow them to understand what they're eligible for or what may assist to stay in their homes. Such as we have quite a few family members from out of town that their parents live in one of the independent living facilities, but they don't know what their parent needs to be safe to live there independently versus having to be in the nursing care program. So we go out, I visit the local facilities quite often to allow the family members to understand what they need. It's something that I believe is truly an added effect for these children that are living in another state,
Sure.
and they don't know who's going to protect mom and dad or who's going to tell them what they really need without going overboard.
Yeah, that's good. Good. So I hope we got some basics underway while we have our masks off, and we can kind of hear some information. But I do want to get in and take a look at the
Sure.
your
Let's go in
inside
for
the
a
building,
visit.
because it is kind of interesting. I think you'll find as we go in here. So come with us.
All right.
Okay, we're in the building. So we're just going to start kind of walking and talking. So I'm going to start with that, Melissa. So this is a scooter. You've seen them all over the place. What's the process for a patient to get one of these and have it at least somewhat covered by their insurance?
That's a really great question, and the reason why is because very often or very limited time is it covered under a patient's insurance, especially on a Medicare. Medicare's ruling believes that if you can ambulate at all, meaning you would have to graduate from a cane to a walker to a wheelchair and then be immobile in your home.
Okay.
People sometimes feel that I need this outside
Yeah.
as I need to go places. Unfortunately, Medicare doesn't recognize that as a billable item because you could take a wheelchair places. This has to be used inside the home for it to qualify for Medicare. So
Okay.
it's actually a little bit more difficult to get that covered
Yeah.
under your insurance plan.
Yeah. Do patients have to go to a special occupational therapist or something like that and have any sort of paperwork filled out?
No, actually,
Or
it could be
evaluation?
just your own family physician.
Okay.
And again, you just have to, pass those, I guess, ruling out that cane or the other ambulatory aids in order to,
Yeah.
graduate to the next level.
Yeah, which is it's a pretty high bar.
Yes, it's a
Okay.
very high bar.
Okay.
Because physicians have to be honest, and we have to be honest when we bill Medicare.
Yeah.
That's the misconception, is a lot of people want things billed, but they sometimes don't understand the process in order to get that billed
Yeah.
isn't as easy as they believe.
Yeah. The other thing I wanted to just ask Melissa about, because you see more and more of these going around town, which is a great advancement for patients
Yes.
who have legs that they can't move well.
Correct.
Can you talk a little bit about this? Have you seen more and more of people using these?
Yes.
Yeah.
Yes. We get a lot of referrals for knee scooters, and that's specifically because crutches, are difficult for
Yeah.
some people to maneuver.
Yeah.
Or a walker is a little bit more inconvenient, such as when you want to go back to work.
Right.
These are knee scooters. We carry the Nova brand, and you can find something that you can build the insurance. Many insurance plans do cover it. All of your group health insurances mostly do.
Yeah.
It's the Medicare and the IDPA Medicaid plans that do not use this because they feel they could qualify for a
Yeah.
walker or
Yeah. Now, fortunately, most people that use these need them for a month, 2 months, 3 months, which means that eventually they're not going to need them anymore. Do you ever rent these out? Or?
Yes.
Okay.
And actually, these are a rental item. They rent on a monthly basis. And then if you do have it long enough during the time, such as your surgery was longer term, it does actually turn into a purchase price. So
Okay.
you may actually own it depending on your insurance and
Sure.
what they require.
Sure. Good. I was just curious about that. Okay, well, let's move on to another area that I think gets a lot of traffic in your store, and we're kind of in the CPAP area, right?
Correct. CPAP is a large percentage of our business.
Okay. So, for those viewers who aren't aware of this, CPAP is, it's first of all, a lot of people have CPAP issues, so it's not just the older
Correct.
population. It's a lot of different ages, even the very young. There's been some recent developments in terms of CPAPs and some recall from
Correct.
the companies. Can you kind of talk to our viewers about what's going on with that and how you're helping your clients to navigate that right now?
I sure can. Philips Respironics actually had a problem with their DreamStation machine, which is a machine that we did cover here at Northern Illinois Home Medical. And we have identified all the patients that are using that machine. The recall was a voluntary recall. Although the FDA is involved, the FDA has not approved the foam that was damaged that needs to go into the replacement machines and or the new machines. So right now we're kind of in limbo, stuck in the middle of waiting for Philips to send out replacement machines or repair the machines that are part of the recall.
Sure.
However, NIHMS took the responsibility ourselves to do this recall. I felt that it was a personal decision for NIHMS to contact our patients and be the navigator through this process. We all know how hard it is for elderly or some others to accept a phone call saying something's recalled or something you have. I use the car warranty as the joke. People don't take those calls or they don't take them seriously. So I felt we should be the ones obligated to assist with the information to provide them with their new machine.
Sure.
So right now we're in the middle of that process and waiting for Philips to have the FDA approve the new foam that's going to go into the machine so they could start dispensing them to us.
Okay.
To replace.
So in the interim, is it because I know that the wording said to have a conversation with your physician about the pros and cons of
Correct.
whether you need the CPAP worse than you need
Correct.
the risk of this foam issue.
Yes, and that's a very, I'll say, touchy subject for Respironics, obviously, to protect themselves.
Yeah.
Although for the patient to understand what is true, what is real, what should I do, but it put a lot of pressure on the physicians. I know we work very, very closely with the physicians of our patients who are on the CPAP, and they're having a difficult time fielding those calls. Not to say that to lessen the recall, but it was a 0.03% that were affected. So 300 out of a million, very low key, but not to those 300 that were affected by the machine.
Yeah.
So while it's a low percentage, it's just difficult because it's hard for the physician to make the decision. Should you keep using the machine and maybe suffer the consequences of some of those symptoms, or should you stop using the machine?
Yeah.
So it's a touchy thing, whereas we're not physicians, obviously.
Yeah.
So we do not tell people to or not to use the machines. We really leave it up to them and their physician.
Yeah, it is a tough situation.
It
because
is.
there's a reason people are using CPAPs.
Correct.
And also, though, from my understanding, there is not a defined time frame of when this is going to be
That's
resolved.
correct. Yes, I talked to our salesperson yesterday, and at the present time, again, the FDA has not approved that new foam. So some of your bigger companies like Lincare and Apria, they have a lot of the market, so they're trying to go to the FDA to kind of push this a little faster.
Okay.
I mean, we're smaller fish in the pond,
Yeah.
although us taking the accountability, I felt would be easier for them to just ship out machines than take so long to contact patients.
Yeah.
Patients move, patient changes phone numbers, and they don't always update us on that. So it's a little more difficult to identify those.
Yeah, okay, very good. And there are other company, I think there's another company that provides CPAPs. What are you?
Yes, great question. ResMed is the competitor to Respironics, and they do. We had switched back to the ResMed machines earlier this year, so our newer patients were on the ResMed machines and some of our older patients. So our DreamStation Philips Respironics machines were kind of caught in the middle for about 18 to 24 month period. So we didn't have as many as maybe some of the other facilities. So we are switching to our other provider, although like a domino effect, everybody's going to run to that other provider, so we're having a difficult time getting those machines.
I'll bet.
So our current patients that are new diagnosed on sleep apnea or need a replacement machine because theirs broke, we're trying to get as many machines as we can from the new supplier because we were already using those machines anyway.
Okay.
So we kind of were banking up on them.
Yeah.
And then we're trying to dispense them. So it's, in a sense, business as normal. But like everything through the pandemic, there's been so many things back ordered, not coming in from other countries. So we're doing the best we can to accommodate what we can.
Yeah, okay, good. All right, well, I think we've covered a lot of CPAP stuff for you, so I hope
Yes.
you got some good information.
We can move on.
Let's keep moving on here. So I'm going to go more towards the back area here, and these are some things that you hope you don't need.
That's correct.
But the reality is, in our lifetimes, a lot of us are going to need this kind of stuff. So Yeah, a little bit about this here, Melissa.
So back here is our bathroom supplies. Kind of a funny story. I did a commercial a couple years ago. I had a catastrophic leg injury and never thought I would be one of those ones to need all these supplies. And now I feel like I own half of the store. But to your point earlier about the prescriptions, because of my catastrophic leg injury, I was able to bill most of these items back here to my insurance.
Okay.
So when I needed the commode and when I needed a bathroom transfer bench to get in and out of the shower, it was something that was covered under my insurance.
Yeah.
Then you have the little extra features, whether it's the grab bars, whether it's the cast covers. Something real popular that people probably don't know we have is cast covers. How many times do you break your arm or your leg and you're using a garbage bag or you're using duct tape?
Yeah.
Well, for $25 to $30, you can actually get a reusable cast cover that people wouldn't think are available.
Yeah, that's a good idea.
Biggest seller is our toilet safety riser. Okay, after you have hip surgery, after you have leg surgery, again, an item that I did purchase, allowed you to stand up from the stool a little easier. And as I did that commercial, it's kind of ironic. I had several customers call in and say, I need to talk to that lady that broke her leg so that she can tell me what do I really need. So that's where our compassionate care comes in, because we're able to use our own information to help without going overboard.
Yeah, great. Good. Okay, great information. Let's go to our next spot that I think a lot of people will either they'll know for themselves or for their families. Talk a little bit about these chairs that we're looking at here.
Yes, this is one of my favorite parts of the store is our seat lift chairs.
Take a little break during the day. And
yeah, we don't tell everybody that we nap in these in the afternoon. However, we did have one customer's husband that did fall asleep in the chair while she was in for a CPAP setup.
That's a good sales
so
pitch.
It was a very good. So I asked him if he would like to just take it home with him. So
for a fee.
For a fee, yeah, we will deliver. With that said, the seat lift chairs are something that a lot of your furniture stores are coming into power mobility, although they don't get you out of the chair. But all the power recliners and power footrest in the couches, that's what we already have for years and years. But our chairs will lift you up into an up position, such as their broken hip, that COPD patient, that one recovering from a knee surgery. Any reason you need help getting out of the chair. How many of your patients, your patients, plop in their chair or rock on their shoulders to get out of the chair? This is a fantastic opportunity to get a chair. I tell people when they come in, people say, I don't need that lift, I don't need that chair to get out. Well, once you break your leg, you kind of do need that. So you're surprised if you're going to spend the money on a lazy boy, why not spend one that's longer term?
Yeah, good.
So the seat lifts are a big seller. They're made in the USA.
Yeah.
And as you can see, we have a lot of stock right now because with COVID, they're on a back order, so we kind of buy ahead. They're on an 8-week build.
Wow, okay, all right, yeah, that makes sense. All right, let's go over this area. I guess I wouldn't think that you guys would have sandals.
Correct.
Tell me about what's the
Correct.
deal with the sandals?
Another commercial grabber that sent in a lot of patients. Again, reminding everybody that we're a retail store that have a lot of things that you wouldn't think that you would need as a typical person unless you had a medical condition. Well, the sandals, I actually have them on right now. I own way too many pair. I probably have about 15 of them because they come in all different styles and colors. But the nicest thing about these sandals is they have the built-in arch support and the built-in heel cup and the plantar fasciitis area to keep you in alignment. It's not only when your feet hurt, but it's your knees and your low back and your hips that keep in alignment. Okay. With that, we have the max arch supports, which are the insoles for your shoes, and you can notice they're on back order right now for a couple more weeks. We actually have probably about 15 to 20 patients waiting for these to come in because there's such a need. Because they're only $39.99, they're much more reasonable than having sometimes custom if you don't need to advance to the custom. But when people buy these inserts, then I always suggest buying a pair of sandals to use as a slipper in the house, because once you wear an orthotic, it's hard to go barefoot after that.
Yeah, for sure.
So we sell a lot of this ortho line.
Yeah, that makes sense. Okay, and then we have, I'm not going to go over here actually, but we have our typical walkers and those kind of things that you would expect a store like yours to have.
Yes, and of course those are what is our most popular billing item. We have the regular walkers that are just your standard walkers, along with your four-wheeled rollators. And those are an item that 9 times out of 10 is going to be billable to your insurance. So that's why we require that prescription so that you can get something covered for your insurance when you're benefiting to have your insurance.
Absolutely. Okay. And I want to go to another spot, if
Sure.
you mind. I'm going to walk over here to an area that I wasn't aware of when I walked into the store, to be honest with everyone. And I'm going to start here. So, Melissa, the Wigs.
Yes, this is in a sense a hidden gem, in a sense that many don't know. And that's mainly because most people you don't really recognize that lose their hair due to cancer unless they're active with Dr. Ali Khan or the doctors in other areas of oncology. But we offer a wig program. But the main thing what we do in here, not only is the wig program, but if you'd like to take a step in here, just real quick, we also offer a mastectomy program. This is the hidden gem that many obviously would not know, that a patient may be wearing a breast prosthesis from a breast cancer, from a mastectomy, but they also need the bras. So with that said, it's again something that's covered under your insurance that many don't know that I even qualify for, or I may not be able to even get. Many don't know that's a service we provide if you're not truly wrapped around the oncology area.
I didn't know I'd walk in here and see this.
Correct,
so
correct.
Really...
And most don't, so that's why we put the wigs outside. Is again and it's a free program.
Okay, so the wigs are free. The bras are things that through
Correct,
insurance and
correct.
that type of stuff.
We do have some patients that come in and buy our bras just as everyday because they like them. But we can bill them if you are a lumpectomy and or a mastectomy patient. And again, have an order from your physician. Also, the prosthesis are billable. But yes, you're right. The wig program is a free program, and we kind of let really everybody choose one for free.
Right. Just part of the mission of...
the mission of, again, that compassionate care and the quality product to allow that cancer survivor. I'm also a cancer survivor. So it was nice because when I was going through my chemo, the girls took it upon themselves to order me a wig that they thought would look like me and had it ready when I lost my hair. So again, being a survivor, it's something that you can actually make personal with somebody. Many don't like losing their hair. I actually didn't mind being bald. And it's just a bold statement for somebody to realize it was you also.
Right. Absolutely. Good. Very good. Well, I'm going to step out from this area, and I wanted to, before we kind of wrap things up, Melissa, I wanted to talk about one other thing that people aren't seeing in this part of the store, but I'm sure it's a big part of your business too, and that's oxygen.
Correct.
So can you talk a little bit about how that works for patients who need oxygen and how that works in terms of your process for that?
Obviously with oxygen, it is a prescribed drug, so you are required to have a prescription. With that, not everybody just needs oxygen. You must desat. You must have saturations of your oxygen levels decrease in order to qualify for oxygen through insurances, such as a Medicare. If somebody is going to, their percentage of oxygen in their body is 88% or lower, then they may be eligible for oxygen. A physician will tell us why they need it and what liter flow and what they need. So you can't just walk in and say, oh, I had a bad bout of COVID, I need oxygen. You must qualify for the oxygen in order for it to be billed. We have oxygen concentrators that are in your home to use in the house and at home. And then we have portable oxygen, which are the tanks with the regulator. We don't define the little mini portable concentrators as part of our rental due to the reimbursement. However, we have them available for resale. We saw an uprise on that, I believe probably from stimulus money and taxes, that we sold probably about a dozen of those already this year. I think COVID has allowed people to realize that I want to be more independent. I want to get around and live life full.
As best I can.
Correct.
Okay. And I'm guessing that you probably, if someone needs oxygen and it gets ordered, that you go to the home to help set that up?
That's correct. With the oxygen, either hospital, whether it's Morrison, KSB, CGH, we work very closely with the discharge planners and, and the physicians also in establishing when a patient needs oxygen. So we'll bring up the portability up to the hospital or to the clinic or wherever they, are at the time of discharge, so that they have it available to go home with. Then we meet the patient at their home and we actually set them up with their home unit and go through all of the safety precautions and the do's and the don'ts and what is available to you for portability to take when you want to go to the doctor or go out, to an event or whatever. And then we also are on call 24/7. So those oxygen patients that may have a problem with their concentrator or something, we do service through CGH and KSB.
Okay.
They call our on-call
So you
tech.
always have someone available.
5 o'clock at night till 8 o'clock in the morning when we open, somebody is always available should you need. Obviously, it's a life,
Yeah.
threatening,
There's a reason you're
yeah,
on.
policy or procedure not to have oxygen, so
Right,
we
right.
will cover that.
Yep, sounds good. All right, well, Melissa, we've had a power-packed few minutes here
We have.
of information for folks, and I know for myself, I've learned several things that I did not know before I walked into your store. So thank you for your time, and for those who are listening, if you have more questions or things that maybe you think you might need or your family might need, feel free to give a call here to NIHMS and/or pop in and talk to Melissa or her team, and they can help you out.
And I
So-
have one more retail item that's brand new that people wouldn't think we have. Liz, if you want to turn around, we
Oh,
have
okay.
puzzles.
Okay. All right.
Through the pandemic, White Mountain was one of the biggest puzzle suppliers in the United States.
Okay.
What else do you have to do when you're home? People got into puzzles. We became a distributor of the puzzles merely for the reason of
Yeah.
people's passion and love. We've had people travel from outside of the area. We had one lady from Clinton that saw it one day when she was in town at
Really?
the CGH clinic
Okay.
and saw our sign said we had puzzles. She came back and she bought 4 of them, that day, and she wasn't even from in town.
Okay. Yeah.
So it's
who would-
again
who would
something
think
you
it?
wouldn't have known.
Who would think it? So
That's right.
Melissa, thank you for your
Thank
time.
you, Dr. Bird.
Yeah.
I appreciate it.